And we're live. Okay. So you've touched on what neurodivergence is and how you cater your practice to help those who may have sensory overload. Could you dig a little deeper and tell us more about how your practice in particular, how regular massage therapy can assist with managing stress, sensory overload, reducing anxiety, and especially for those who experience the world through a neurodivergent lens?
Yes. I am the first to admit I have fairly extreme bias. For me, receiving massage is the biggest tool that I've brought to bear on like a history of the kind of classic array of other psychological impacts that we also often take with neurodivergence. Like, they say, I'll just add this detail, it's a little off topic, but that's that ADHD for you. They say that especially women, because our presentation of ADHD is not what was originally outlined when they developed the diagnostic criteria, that we average 5 misdiagnoses before they land on ADHD. And the like medication regime or whatever intervention you end up settling into is effective. So really typical to get a diagnosis of bipolar disorder, of clinical anxiety or depression, sometimes borderline personality, like so many different variations. Fibromyalgia, interestingly, is like a common misdiagnosis. So I went through my 5 before settling in, and had a lot of really wild experiences trying to manage the wrong underlying cause of the presenting symptoms, right? So in the end, with what I know now, what I really find the absolute most effective is the massage therapy, that it allows me to reset, to take control on the rhythm that I find that I need, which can vary depending on what's going on in my life. And so I get to make my own adjustments to how often I want an intervention. But for people who are having like really strong anxiety presentations or like panic disorder type presentations on a symptom level, so often what's driving that is the like fundamental neurochemistry of connection and the sense of being isolated from the tribe and potential like rejection trauma, or not having that basic access to the oxytocin of a hug or a connection with another person. And we often need more, like we just mechanically need more physical contact than a lot of other people. Some people with neurodiverse presentations will be more averse to physical contact, and there are some reasons for that, but about half of the reasons for that add up to traumatic experiences that kind of push them away from accessing those resources, right? And so especially for people who tend to kind of hug their friends a lot, have really bodily expressive interactions, or for people who are alone a lot, which may have to do with their symptom presentations, the difficulty of managing it, or other people's responses to their symptoms, that the baseline physical touch and the impact that has on our nervous systems is really key, the experience of connection. So they say like so many different cultures and healing traditions have come up with this different ways of saying the idea that love is the best medicine, or love is the real medicine, right? And I think that is exemplified really clearly on the massage table when people are able to just receive the touch and care and full attention that allows the system to go into that state of relaxation like a baby falling asleep that has nothing to worry about, and to get into those really old places of the mind and the connection of the mind and body where restoration can happen, and new potentials are activated, things that are forgotten in the possibilities of your life.
I'm not crying, you're crying, it's fine. That was beautiful.